Okay, this is part 4 of my video blog for my bunionectomy surgery. I also had a joint taken out and fused to an adjacent bone. They call that the arthrodesis of the first metatarsal. So you can see my scar right now, and you can actually kind of see a comparison between my left foot, which obviously had the surgery, and the right foot. It's obviously still swollen, but it's gone down a lot. My ankle is a normal size. Something that's typical after happening a couple weeks after surgery is you'll have these little pieces of, dried blood that'll just kind of flake and dry off, and it'll completely heal itself. And again, this is all after the stitches have been taken out. It's gross, but it's just part of the process. Another thing I wanted to show you as well is, if you couldn't tell from this image, is how a lot of the black and blue marks have completely gone away, and all that's really left is the swollen aspect. There's a couple little black and blue marks, maybe, right there on the back of my foot, but for the most part, all the redness, all the bruises have gone away. Another great thing is I haven't been taking any pain pills for the last couple days following my last follow-up, which was 2 weeks ago. I was taking about 1 to 2 Loratab a day. That's what I was on, and it actually helped a lot, but I didn't really need more than that, and luckily the last couple days I haven't had to have any. So went to my doctor's again today, and I'm in that boot that you kind of see over there. That's what my foot's in. And I've been working on my range of motion or movement with my big toe, making sure that I'm moving it from the joint right here. You don't want to just wiggle your toe. You want to really, make sure you're moving it and hold it and move it with your finger. And you want to do that for about 3 to 4 times a day for about 5 to 10 minutes each time. Really helps. Great news today is that I get to start walking on my foot, but I need to walk with crutches. Basically what the doctor asks you is he asks you what your weight is, and for you to divide that into 3, and this following the 1 month milestone. The first week after that, you put 30% of your weight on your left foot. Week following, you put 60 or 2/3. If that's right. And then following that, it's all your pressure, just like normal, no crutches. So it'd kind of be first week, 2 crutches, second week, 1 crutch or a cane, third week, no crutches, and you're walking in the boot the entire time. You're also supposed to sleep in the boot. However, I've had issues with my ankle sleeping in the boot, so I haven't been, but luckily everything's been good. Other than that, I have some x-ray pictures from today. If you can see, that's a side view of my foot, and I have a plate and a large screw in my foot. It's a lot larger than I thought it would be, but it's almost about 2 inches actually in my foot, and it's holding my first metatarsal in place because it was fused to that adjacent bone. So that's typically how they do that. And the plate has 4 screws in it itself. So let me see if I can find, here's some other pictures. It's a little difficult to see that one. So there's a front shot with the plate and the four screws and then the 1 screw. So that's where I'm at right now. As you can tell, the swelling's gone down a lot. And typically what you want to do that I find helpful, this isn't something the doctor has recommended to me, but it's something that I would definitely suggest doing, is making sure that you do wash your foot. You may think, oh, I'll just, let it rinse off in the shower, but you will find after week 2, your foot will start to sweat a lot more, and it'll start to smell, especially in that boot. So you want to make sure you take the time to just, delicately wash your foot with some antibacterial soap. When you're done, I like to use something like this, which is an antibiotic and a pain relief cream, and I just put it on with a Q-tip so nothing touches it. I still want to keep it as clean as possible, and I just apply it, and then I take a little bit of gauze, put it on top, and then I take my bandage and I wrap it. And then that bandage obviously goes into my boot, and that's what I do every morning after I take a shower, and it's been helping me immensely with the healing process with my scar. Next time you see me, I will be walking, and that will be following my next doctor's visit, which will be almost, I want to say, 2 months out after my surgery. But I'm really impressed with the results this quickly, this far. Everything's actually healed really quickly based on these x-rays that you see, but that also has to do with 3 components: your health, your age, and your weight. So I'm lucky in that factor. Some people aren't necessarily as lucky, and I feel for them because I can't imagine still being in that much pain this much, later. But if you do what your doctor says, and if you take some calcium, that also helps the process. So that's where I'm at now, and I will see you guys in a little bit.